Bismillahirrahmanirrahim. My name is Duaa Alromaili. I am a final year resident. I'm very proud actually to be invited over here to talk about the pediatric as a specialty that you go after your internship. To define being a pediatrician is not only being a doctor for children that treats children for their illnesses. It goes beyond that it's treating the child in terms of his physical, mental, developmental, and how they are going to be better adults later on. So being a pediatrician does not only mean treating the child, it means also being an advocate for the child by being in a very good place with very good parents, developmentally very well, attending school very well, and also having a very good health as a mainstay for what we care for. To be a pediatrician, actually, it requires a high level of good professionalism and communication, because it starts by dealing with a child and playing with the child or your patient, and ending by also dealing with the adult who are the parents or even your co-workers. So it's a field where it requires actually a lot of communication and professionalism, and also being somehow having an inner child inside you. My journey when I have joined the pediatrics, it's actually the good part about it that it has a very good social life for the physician and also for the patient, that you can take care for the patient as an outpatient and based on outpatient care, like in clinic or being an educator, or even as an inpatient, or somehow just like some other physician they can do as covering both. They cover as in governmental hospitals, and then later on they can have they can start their own business. So becoming a pediatrician also, it takes a lot of skills in being a researcher, because it's a very high field where it has a lot of investigations for the diseases and a lot of changes in the treatment in order to provide a better care. So it's actually a mandatory part of being a pediatrician to be actually a good researcher. I would like to talk also about the bad part in being a pediatrician, or not a bad part, or the obstacle that you can face. Somehow being attached to those little children is not something that you can control sometimes. I personally have faced that in the very first years of my residency. Somehow being attached to those patients with chronic illnesses, you feel like they don't deserve to have this life, or they don't deserve to have the complication of the disease. But it's not actually the right attitude to escape away from that. The right attitude is to be as much supportive as you can, and to be or to give them the happiest moments and the best moment that they can have before they can have those complications, or at least when they لا قدر الله they have left life. The second thing, that in the pediatric it requires a high level of reading, by which that especially in the first 2 years it requires a high level of reading and a lot of communication skills to be acquired, especially for dealing with children and dealing also with the adults and adolescents as well, who are actually somehow can be very uncooperative.